Scleroderma. Hello and welcome to the end of June, a month known as Pride Month for the LGBTQ plus community, raising awareness and support for people whose sexual orientation or gender identity doesn't conform with traditional Western norms. What you may not know is that June is also a month of awareness and support to sufferers of the little-known illness scleroderma. While most of us may know and recognise the struggles of those in the LGBTQ plus community, it is almost certain that most do not know about scleroderma and the struggles that people with scleroderma face. So let's lift the blinds on this topic today and discuss the debilitating struggles, the fear of the unknown, and the wide variety of the symptoms that come with the diagnosis of scleroderma. Let's start with an anecdote. A middle-aged wife and mother of 3 adult children leaves her soul-crushing retail job and begins to build a new life around her hobbies, husband, and friends. After years of being belittled and talked down to, she finally starts to feel free and happy. She joins a knitting club, goes for walks with her dogs, and looks forward to her Saturday lunch dates with her husband of 30 years. One day she gets a cough. She feels it in her chest. Is it corona? She's been very careful and there isn't any community outbreaks, so it's unlikely, but she'll get tested anyway. It's not corona, and she waits to see if it goes over. It doesn't. She feels it in her lungs. It hurts. After a week, her whole body hurts. She feels cold all the time, but sweats as well, and she feels so tired. So tired. She goes to the doctor, and after tests, she gets 2 diagnoses, interstitial lung disease and scleroderma. At home, her and her husband type it into Google and read the first result on the page. Life expectancy, 3 to 5 years. That story is true, and that woman is my mother. When we learned of her illness, we were all in shock and terrified, but the story doesn't end there, and as we all know, a web search is never the be-all and end-all. So like every person diagnosed with scleroderma, we need to take a deeper look at what scleroderma actually is, how it presents itself, is there a future to be had for those with scleroderma, and if yes, then what does that life look like? Scleroderma is an autoimmune disease with a variety of symptoms, and which makes every case different and at times little overlap between sufferers. One commonly shared symptom, however, is a hardening and tightening of the skin. Usually this begins to appear on the face, feet, hands, and fingers. In some patients, hardening of the skin spreads to almost all areas of the body. Think elbows, knees, thighs, and chest. However, like many symptoms of scleroderma, this is not universal, and the tightening and hardening of the skin might not even be noticed by the patient. While we're already on the topic of skin, we should talk about the scarier side of the skin aspect. They have flare-ups, they get ulcers on their fingers and toes, and they can lose the tips of their fingers and toes because of gangrene. As an example, one guy in England had to have a hand transplant after a bad flare-up. The flare-ups can cause strong tiredness and pain, so while their lungs and heart might not be as affected, they can still become very sick from viruses that their body can't fight because it's already fighting the flare-ups. Let's move on to hands. Scleroderma can mimic a lot of arthritic symptoms, and as time progresses, even younger patients can end up with claw-like hands that are painful and not fit for purpose. The decline in quality of life is unimaginable. Imagine not being able to type, play video games, draw, write, knit, and that's just hobbies. What does a work life look like for people with these symptoms? The financial impact of this kind of illness is devastating. When you take into consideration the routine need for blood tests and doctor visits, even a mild case can put you into debt depending on where you live. This brings us to lungs, an area of scleroderma that my family is more acquainted with. Basically, scleroderma causes scar tissue on the lungs and heart. This scarring causes the lungs to reduce its volume capacity, leading to shortness of breath and fatigue, which in turn leads the patient to exercise less, and because of that, their lung function decreases again. The blood vessels to the lungs can also be affected, causing hypertension. This is not the whole list. In fact, it barely scrapes the surface, but I hope it impresses upon you the wide variety of symptoms, both seen and unseen, and the varying impact on the lives of scleroderma sufferers. While the illness can be very tame for some people, the secondary attack from viruses and infections not related to the illness itself can be life-threatening, which is exactly the situation my mum and family had to face in May. My mum got a tummy bug, she thought. She felt sick, couldn't eat, and while this wasn't necessarily alarming to begin with, after a couple weeks she had lost 10 kgs and was still struggling to eat, walk, and eventually to even get out of bed. She went to the doctor, he felt it would pass, and the weight loss, well, her appetite will surely come back now after having lost so much weight. Mum went for her regular blood tests, and when the results came in, she was admitted to hospital straight away. To put it bluntly, she was dying. An infection was raging in her body, causing low blood pressure, low potassium, low B12, iron, the list goes on. Dad truly thought he was about to lose her, and I was sure I would need to fly home to be by her side. She pulled through, of course, not before catching the coronavirus and dealing with little to no white blood cells. Now she is back home. She looks better. She can almost walk around the park now. The worst is over, right? Well, we are now waiting to find out if she will need an operation to enlarge an artery, and it's looking ever more likely that Mum will have to sleep with an oxygen mask at night. I don't want you to feel sorry for my mum, but I want to impress upon you the roller coaster ride that is scleroderma. It's not necessarily a death sentence. It might not dramatically affect your quality of life, but its greatest attack is against certainty. The sufferer and their family can Google the word, they can read about others' experiences, but can experience something entirely different. Yes, the risk of secondary illness is increased, and that is certain, but everything else, it seems, is a roll of the dice. Patience is a virtue, but with scleroderma, it is the only way to survive. While the advice I can give is limited, like many illnesses that are complicated and variable, I would like to share 3 tips for if you know someone with scleroderma. First, be a good listener, both to the sufferer and their family. The weight of the unknown future ahead can be extremely heavy, but the weight is best carried when shared. Be open to hearing about their fears and concerns, but also be ready to celebrate achievements. Did they manage to get a row of knitting done despite their painful joints? Awesome! Ask to have a look. Secondly, be flexible. Maybe you have a trip planned in a couple months, but they have come down with a cold. They'll likely need extra time to recover, and while that sucks, it could be worse. Be encouraging and ready to change plans as needed. Maybe you can go on a small excursion in your area instead once they feel up to it. Lastly, but most importantly, be an advocate. Doctors' visits are hard, and it can be difficult to process the information and even to bring up questions that they've had on their mind. Can you go with them to the appointment? Can you remind them of what they wanted to talk about with the doctor? Is their doctor listening to them, or do they need your help to press upon the doctor the seriousness of the symptoms they are having? You might not be able to do all of these things, but if you can do 1 or 2 things, it can have a positive impact and can help them still feel included in the outside world and in your community. And it can help their close loved ones who might be struggling emotionally with the illness. In summary, scleroderma sucks. It's scary, little known, and can be debilitating. By watching this video, you have already helped the community by sharing the knowledge. That's awesome. You can help even more by sharing the video or by checking out the description box and choosing one of the links to pages with more detailed information and links to support groups for people with scleroderma. Thank you so much for making it to the end of this video. I'm glad you listened to my mother's story, and it means a lot to her as well. I'll be sure to keep everyone updated with changes in her health as appropriate, so subscribe if you want to be notified about that. Until then, have a wonderful day. Hey door and goodbye.